From Eyewitness News, Connecticut's most watched local political program, this is Face the State.
And a very good Sunday morning to you. I'm Dennis House. Thanks for joining us. We just saw the newest Connecticut COVID-19 numbers. Hospitals are under tremendous pressure in treating the sick these days, but the news lately has been pretty encouraging. First off this Sunday, the president and CEO of Hartford HealthCare, Jeffrey Flaks. And Jeff, thanks for joining us once again.
Good morning, Dennis.
So let's talk about these numbers because they appear to be trending in the direction that you and the governor would like them to be.
We're very pleased and very encouraged. The numbers are trending downward. We're just coming on 9 days. So we're hoping this continues.
When this first outbreak began, almost 2 months ago, were these the numbers you were expecting today?
Well, we did modeling, I think, as you know, with MIT and the dean of their analytics program, Demetrius Bertsimas. He had called for the peak to be the 27th of April, so it's fairly close. I think as it turned out, we might have been off by 4 or 5 days. So I think the modeling was really crucial. It allowed us to plan and staff and get the right equipment in place. So I think the modeling is going to prove to have been reasonably accurate given the crisis.
With the number of hospitalizations going down, is that taking off the pressure on some of your staffers?
Well, I would say this. First of all, we're still caring for a significant number of people in the community. And at the same time, Dennis, we've never stopped doing what we do. So delivering babies and heart care and trauma care and stroke care and all the different things we do. So I would say no. We still stand ready. We're still on high alert. And at the same time, we're still caring for many people with COVID-19. So all of our precautions, all of the rigor, the discipline, it's all still in place.
You know, I want to ask you about elective surgeries because so many people keep writing us. They're still afraid to go to a hospital because they're worried about COVID-19 and they're putting off that knee surgery or that hip surgery. What's your recommendation on that?
So we hope to be standing up all of our surgeries in a graduated incremental process over the next few weeks. We're working through that planning right now. First of all, it's safety first. So we're going to make certain that we can give the public confidence that there should really not be trepidation. And I would remind everyone that during this process, cancer care, significant cardiac and interventional services, major surgeries for trauma, these complex surgeries have been going on as necessary. So as we migrate now into essential surgery, but surgeries that are very predictable and manageable, we'll be doing it with high confidence and we'll ensure the public safety and the safety of our staff.
Let's talk about widespread testing. Where do you see that eventually coming into play? Because so many people out there want to get tested, but they can't without a doctor's appointment.
Well, first of all, we made great progress with testing. I'm so proud. I'm so pleased. We opened up testing centers this week. Westport today. We have Enfield going live next week. We are going to be going live in the north end of Hartford, Mystic, Torrington, Avon. We continue to operate testing sites at every one of our hospital campuses. So we'll have 9 testing sites open by early next week. So wide-scale testing, it's critical. It's going to be how we restart the economy in Connecticut. It's important, and we have now moved forward. We're doing it without a physician note. So we've put new procedures in place, make it more accessible, easier to do, in more large scale in operation.
Let's talk a little bit about antibody testing. I know in the New York area they're really heavy on that. We haven't heard much about it in Connecticut. What role does that play?
So we're doing it. We've been doing antibody testing for our own staff, frontline healthcare workers, people working in emergency services. It's an important part of the process. It can be done through phlebotomy in physician offices and traditional clinical laboratories based in the community. So what it does, it'll allow us to help manage people who've had and been exposed to disease and have some level of immunity. But the science is still unclear in terms of the duration of the immunity, to the extent of the immunity. But it is part of the important data that we'll need as we start to develop more confidence in the community.
Jeff, when things begin to open on May 20th, what is your recommendation from a medical standpoint to people who are going out in public, to restaurants and to hair salons? Should they wear masks all the time?
Absolutely. We need to follow the guidelines. They've served us very well. The work we've done on social distancing, the sacrifices that so many people across our communities have made, which have been extraordinary, are paying dividends. And it's why we see the hospitalizations fall. So it's going to be very crucial as we reintroduce new services that we follow the guidelines very closely and that we ensure that we monitor the data daily so that we can make adjustments as necessary. So it's a gradual process.
So the mechanics of that, when you go out to eat at a restaurant, you'll have to take your mask down, obviously, to eat. Can you leave it off?
I believe what's going to be done is, as we're told, is tables are going to be set apart. There's going to be special procedures and precautions put in place for wait staff and serving staff. So I'm confident that the governor's team in the state are looking at best practices, and there's a dynamic tension between restarting the economy and doing it safely. And I believe we're taking the right path as we go forward.
When do you think the hospitals will be reopened to visitors?
So that's an important question. And at this point in time, we still maintain visitor restrictions in place. One of the things I'll say, Dennis, I'm so proud of, and it's one of the advancements. I often say I don't want healthcare to go back to normal. People keep talking about when can things go back to normal. And healthcare, I don't want them to go back to normal. This is one of those examples. Our team, our clinicians have done an incredible job using technology, cell phones, iPads, Skype, and other types of technologies to now bring visitors into the room from far and near, and have made our team much more accessible, and they've connected with our patients. So we want visitors to be back, but we need it to be at a time when it can be done safely and under the proper precautions. But in the interim, we're doing everything possible to safely develop ways that they can communicate with their loved ones when they're under our care.
What happens if you have an accident at home, you break your arm, or perhaps you have a cut that needs stitches and you have to go to the ER? Who can go with you?
So today, the vast majority of people are being brought into the ER, and then the patient themselves are being triaged into the clinical care settings. So we're working through procedures on how we maintain communication with their loved ones. But we have to be very disciplined about where and how we bring patients into these environments during the COVID-19 crisis. And
do you foresee a time, perhaps 2, 3, 6 months from now, where we're not wearing masks in public?
It's hard to predict. I hope so. I certainly hope so. I think the key right now, based on what we know today, and while all of the different medications are under trial, and are evolving right in front of us, while there's really progress being made around vaccines, is to do our best to use the masks, use every precaution we can, and then look at what the data tells us week to week, month to month, so that we can start to figure out when and how we can lift different precautions.
And finally, I know you're getting a lot of donations in there. The Denise Asenzo Foundation's making a donation this week for Nurses Week on scrubs, and you've been getting masks and gloves and things like that. What else do you need?
So first of all, the support from the community, the Hearts for Healthcare Workers, has been incredible. And our people appreciate it so greatly. The donations of food, the donations of personal protective equipment have been absolutely crucial. But equally important has been this esprit de corps that people feel within the community. So we do have a system in place. If you go to our website, it describes what our greatest needs are and how to support us. But all healthcare organizations are being recognized today. And thank you for recognizing Nurses Week. It starts on Monday. It's the 200th anniversary of Florence Nightingale's birthday. It's the year of the nurse, and it couldn't come at a better time. Has there ever been a moment where we've had more respect, more appreciation for the profession of nursing, what it means, and how it matters when we need it most?
We're looking forward to Nurses Week this week as well. All right, Jeff Flaks, CEO and President of Hartford HealthCare, thanks again for joining us today.
Thank you, Dennis.